For what purpose does the gentleman from California seek recognition?
Madam Speaker, I move to suspend the rules and pass the bill H.R. 4414, the Expatriate Health Coverage Clarification Act of 2014.
The clerk will report the title of the bill.
H.R. 4414, a bill to clarify the treatment under the Patient Protection and Affordable Care Act of health plans in which expatriates are the primary enrollees and for other purposes.
Pursuant to the rule, the gentleman from California, Mr. Nunez, and the gentleman from Washington, Mr. McDermott, each will control 20 minutes. The chair recognizes the gentleman from California.
Madam Speaker, I ask unanimous consent that all members have 5 legislative days in which to revise and extend their remarks and to include extraneous material on the subject of the bill under consideration.
Without objection.
Madam Speaker, before I yield to my good friend who helped co-author this bill with me, I would just have a brief statement. The Expatriate Health Coverage Clarification Act is a result of close bipartisan collaboration and extensive discussions with the Obama administration. I would like to thank Mr. Carney for his work on this important bill, along with our numerous bipartisan co-sponsors, original co-sponsors. The bottom line is that this is a jobs bill, one that has been carefully drafted to address the unique problems related to expat health insurance. Madam Speaker, at this time, I yield 6 minutes to my friend, Mr. Carney from Delaware.
Thank you. I want to thank the gentleman for yielding and thank him for his hard work on this very serious issue that affects both our states, Delaware and California. Madam Speaker, in a state of 900,000 people, losing 500 jobs is a serious blow. That's how many jobs we'll lose in my home state of Delaware if we don't pass this legislation on the floor today. I'm a strong supporter of the Affordable Care Act. So are a lot of people in my state. But no law is perfect, and in a law as important, as complicated, and as technical as the Affordable Care Act, there are bound to be a few things that needed to be fixed. The Affordable Care Act was unintentionally written in a way that subjects U.S. expatriate health insurance plans to all the provisions of the ACA, which places a unique burden on these types of plans. Expatriate health insurance plans offer high-end, robust coverage to people working outside their home country, giving them access to global networks of healthcare providers. Individuals on the plan could be foreign employees working here in America, Americans working abroad, or, for instance, a German working in France. These employees can be NGO and foreign aid workers, pilots, cruise ship workers, and contractors sent to support our troops on deployment around the globe. Expatriate plans ensure that these employees have worldwide access to quality health care while working outside their home country. Several U.S. health insurance companies, Cigna, MetLife, Aetna, and United Health, offer expatriate health insurance plans. The employees who write those policies generally work here in the United States and make up several thousand U.S. jobs, including 500 in my state. These insurance companies compete with foreign insurance companies that also sell expatriate health insurance plans. The issue is these foreign plans don't have to comply with the Affordable Care Act. Forcing U.S. expatriate insurance plans to comply with the Affordable Care Act gives their foreign competitors a distinct advantage. It makes plans written in the U.S. more expensive, which gives companies an incentive to purchase foreign-based plans instead. As a result, it makes more sense for U.S. expatriate insurers to move their business overseas, resulting in the potential loss of a few thousand jobs. In Delaware, that's going to mean 500 jobs. In California, it's 700. The good news is that we have a bipartisan legislation here today that will level the playing field. The Obama administration has already recognized that it's burdensome and unnecessary to require expatriate insurance plans to comply with the Affordable Care Act. In fact, the administration has provided temporary regulatory relief for expat plans from nearly every Affordable Care Act provision that's gone into effect so far. The problem is this relief is only partial and only temporary. The administration can't make this relief permanent without a legislative fix. Our legislation clarifies that the Affordable Care Act does not apply to expatriate health insurance plans. It ensures that American expatriate insurance carriers are on a level playing field with their foreign competitors so that American jobs stay here in America. You may hear on the floor today that this bill is about destroying the ACA or changing our immigration laws or giving a handout to insurance companies. But let me assure you, that's not what it's about. It's about jobs, pure and simple. If we don't pass this legislation today, people who have the expatriate plans and their companies that offer them will continue to do so, the same as they are today. The only difference is that the companies will buy these plans from insurance carriers that write the plans from abroad. That means those insurance jobs will go to foreign workers instead of workers in America. They'll go to workers based in Singapore instead of those based in Delaware. I understand as well as anyone that the Affordable Care Act is a political weapon in a larger political war on both sides of the aisle. But that's not what this bill is about today. All I'm asking today is that we take action so 500 hardworking Americans in my district don't become collateral damage in this partisan political fight. Let's call a temporary truce in that battle today to protect these jobs. I thank Congressman Nunes and Ways and Means staff for their hard work on these issues, and I want to thank the leadership on both sides of the aisle for recognizing this is a serious problem that needs to be fixed. And I ask my colleagues to vote yes on H.R. 4414. Thank you, Madam Speaker. I yield back.
The gentleman from California reserved. The gentleman from Washington is recognized.
Madam Speaker, I yield myself such time as I consume.
Without objection.
The Republicans have branded this bill as clarification. But what demands clarification is the cold, hard fact that this legislation is a bailout for insurance companies. This has never had a hearing in the House. It's never been discussed. We've never had witnesses, no regular order whatsoever. This appeared out of nowhere. This bill, pure and simple, is a case of Republicans seeking special treatment for certain insurance companies who would like nothing more than to avoid the responsibilities under the law and sell inferior insurance policies to Americans and foreign workers and their families in the United States, which is exactly why the American people are fortunate to have the ACA as the law of the land, is currently protecting them from this kind of intolerable insurance company practices. Republicans have focused on coming out against bailouts for insurance companies in several other ACA contexts, but there's all sound and fury because it means nothing. With this legislation, our Republicans want a bailout for a few insurance companies that sell so-called expatriate coverage. But why should this situation be any different? Why do the Republicans get to pick and choose? As the Republicans now in the business of picking and choosing winners in this case, the losers are going to be the patients. Republicans claim this bill is a simple fix intended to clarify the ACA when it comes to expatriate coverage. And perhaps there is a need for that. Perhaps there's a need. We might have found it out if we'd had one hearing. The current guidance defines individuals under expat plans as those who are out of the country for at least 6 months during the year. The theory is that the people are gone more than they're here. But this bill overrides current regulations and ignores the comments given by the administration to define a covered individual. And it does it and says you're an expat if you're out of the country for as few as 90 days or 15 trips. Now, I don't know how many people in Seattle make 15 trips out of the country in a year when they're working for Boeing or working for Microsoft or all the international companies. I got those people in my district. This means that to serve people who move across the border daily or frequent flyers for work would be exempt from the enrollees who have gone for only a few weeks. In addition, the legislation says that all foreigners who are living and working in the United States but are outside their own country for 90 days or 15 trips can also be covered by these plans. As a result, the provisions of this bill would severely undermine current H-1B visa requirements that level the playing field with American workers. If you're bringing people in from the outside and they go home or they're gone for only 90 days, well, you can somehow pay them less. This legislation will open the door for U.S. employers who wish to avoid the ACA to hire foreign workers rather than American citizens. That's why the United Farm Workers are against this bill. The United Farm Workers do a pretty good job of clarifying this bill when they say, quote, Congress should not pass laws that create an economic incentive to hire guest workers over professional U.S. agricultural workers. The AFL-CIO is against this bill because it would undermine the health security of 13 million green card holders, people with work visas, and individuals who were granted visas for humanitarian reasons. The National Law Immigration Center is against this bill because it eliminates minimum essential standards for, quote, expatriate health insurance plans provided to individuals who travel abroad. As a result, this bill would deny health coverage security for low-wage immigrant workers, including farm workers and caregivers. This bill contains too many loopholes that amount to an extraordinary bailout for insurance companies. This bill also establishes a precedent for employers to hire guest workers. It's being brought here as a suspension bill with no opportunity to amend it. It might be that we could make it a better bill if it had been through the process, but it's being rammed through here by insurance companies who want to get a benefit. This bill is yet another attempt on the part of the Republicans to repeal the Affordable Care Act. They want to drill another hole in the bottom of the bill. They're going to keep drilling holes, trying. This is number 53, and I reserve the balance of my time.
The gentleman from Washington reserves. The gentleman from California is recognized.
Thank you, Madam Speaker. Just to clarify the record here, this has been worked on in a bipartisan way, including the two senators from Delaware, senator from New Jersey, who happen to be Democrats. A lot of the language that was in here was worked out so that, in fact, this could not only gather bipartisan support in the House, but also quickly pass in the Senate. Because as my colleague from Delaware pointed out, that if this doesn't pass and doesn't pass quickly, these jobs are going to leave overseas. And that's why this is just a clarification. And at this time, I'd like to yield 1 minute to my good friend and former Dairy Caucus co-chair, Mr. Welch from Vermont.
I thank the gentleman. I'm a strong ACA supporter. We've got to improve it. We've got to make it work. And that's the reason why I'm supporting this legislation. Some efforts that are brought to the floor about the ACA are about unraveling it. But those of us who are the strong supporters, when an issue is identified that can help jobs and make some improvements, we have the responsibility, in my view, Madam Speaker, to advocate for those changes. We have the member from Delaware, a strong supporter of the ACA, who has identified a specific problem. And I understand the concerns of the opponents because many efforts are made to unravel the law. But there's been an acknowledgement that there is a problem that is being addressed by Mr. Carney. And if the language is not as good as it should be, and part of that may be because we didn't have as much time to consider it, we have strong allies in the Senate, Senator Carper and Senator Coons, both very strong ACA supporters who are willing to make the adjustments over there, not to mention the majority leader, Senator Reid. I ask for another.
An additional 1 minute.
The gentleman is recognized for 1 minute.
So this is not perfect, but we've got a situation here where it's acknowledged by both sides, the opponents of this bill and the proponents of this bill, that there is an issue because of the language in the ACA bill. And if this Congress were working the way ideally it would, when there is a problem that we could identify, we'd come up with a specific solution. If we had more time, it might be better language. But the fact that we would act here to keep this alive, give some hope to those folks that Mr. Carney is concerned about, whose jobs are at stake, and then work with our colleagues in the Senate to make whatever improvements can be made, we could maintain the strength of the Affordable Care Act, preserve the jobs that may be lost in Delaware and California and elsewhere, and demonstrate some flexibility to make all our legislation that by definition is imperfect better. And that can be done on a bipartisan basis. So I thank the gentleman, and I thank my colleague from California, and I yield back.
The gentleman from Washington is recognized.
Madam Chairman, I yield to the gentleman from California, Mr. Waxman, 4 minutes.
Gentleman from California is recognized for 4 minutes.
I thank you for yielding to me, and I want to say to my friend from Vermont, a member of my committee, this is not the way to pass laws. This is not the way to correct problems. Problems should be worked out through narrow fixes in a public setting. This is a bill for an insurance company that is threatening to fire people in the district in New Hampshire, in what is it? Delaware, and a little small part of California. So that insurance company is saying, well, we're going to fire these people unless you correct our problems. The Republicans will not correct their problem. They want to have a big hole in the Affordable Care Act. Well, you can believe the Senate may fix it, but the suspension calendar should not be used for bills that have never been considered in an open hearing and that cannot be amended on the floor of the House. This bill goes far beyond a narrow, sensible fix. It says that Americans who are out of this country for a matter of weeks can be sold policies with harsh annual limits on their coverage, no minimum quality standards. And it says the families of these Americans, who may not even be overseas but be living here, will get a plan that will be of lower quality than other Americans, even though they live here 365 days of the year. The bill's supporters say these expatriate plans are very high quality, but the insurers and Republicans refuse to accept a bill that subjects the plan even to the most basic standards of quality and affordability. Why? There's no reason for that, except they want ACA to have be in competition with plans that are lower quality. This raises real concerns. Worse yet, this bill goes far beyond its stated goal of addressing coverage for Americans who live overseas. It's not that narrow. It creates a whole new second-class health insurance system for foreign workers and legal permanent residents. These individuals currently have access to ACA-compliant plans, putting them on even footing with U.S. workers. It would undercut current law. It would weaken the rights of immigrants and foreign workers. It would create powerful incentives for employers to hire foreign workers instead of U.S. workers. So this bill isn't about a narrow thing to fix some possible unemployment in these two states. That's why this bill is opposed by organized labor. It's opposed by immigrant advocacy organizations. There were long negotiations in back rooms between Republicans, Democrats, the administration, and the insurance companies. But there was no agreement on this bill. No one would compromise. And that's disappointing. It's mainly because of the intransigence of one insurance company and the Republican leadership. We should not advance a deeply flawed bill because an insurance company is making threats. We shouldn't advance a deeply flawed bill with the expectation somebody else is going to solve the problem. That's why we're here in this House, to make sure the legislation is as good as it could possibly be. If all parties are ready to act in good faith, they should go back to the negotiating table and solve the narrow problem we can agree on, rather than opening a troubled loophole in the ACA. And I yield back the balance of my time.
The gentleman from Washington reserves. The gentleman from California is recognized.
I reserve, Madam Speaker.
The gentleman from California reserves. The gentleman from Washington is recognized.
Madam Speaker, I yield 4 minutes to the gentleman from California, Mr. Becerra.
The gentleman from California is recognized for 4 minutes.
I thank the gentleman for yielding. Let me first acknowledge the work that's been done by so many of our colleagues here, bipartisanly, the gentleman from Delaware, the gentleman from California, the committees of jurisdiction, leadership, I suspect, on both sides of the aisle. I, too, have been involved in trying to deal with this. If you take a look at the title of the bill, it tells you what they're trying to do. The bill is called the Expatriate Health Coverage Clarification Act. So the bill tells us that it's to deal with the issue for expatriates. who are expatriates and how are they impacted by the Affordable Care Act? Expatriates, I think most of us would acknowledge, is an American who is told by his or her employer, need to send you abroad to go work, whatever the task is, got it, but I need you to go. Should that expatriate now living abroad be told that he or she must have an insurance policy that abides by the Affordable Care protections for Americans who get health care here? The companies, the insurers will say, well, you know, we may have to deal with different standards in that other country, so give us some flexibility. That's very fair. We should make sure that any company that must send a worker abroad has the flexibility to make sure that they're providing good coverage, but they're not strapped by the regulations that apply to coverage here in the U.S. Everyone agrees with that. Here's the problem. This bill doesn't do that. It doesn't do that. And I say that with all due respect to my colleague from Delaware. It doesn't do that. Let me ask you this. Is someone who works in this country 365 days of the year someone who we would consider an expatriate? Is an American who spends most of his time, 3/4 of his time, working in the U.S., an expatriate? Should the family of that American who goes abroad, but the family never leaves the U.S., be denied the protections of the Affordable Care Act so a pre-existing condition can now not be used to discriminate against the child of that American worker? That's the difficulty with this bill. This bill talks about expatriates, but the reality is a lot of Americans who never leave this country and a lot of foreign workers, including green card holders who are on their way to becoming citizens, who have every lawful right to be here because they've gone about it the right way. They're just waiting their time so they can qualify to become U.S. citizens. They would all be, many of them could be denied the protections that we now all have. We cannot be discriminated against based on a pre-existing condition. We must be provided minimal protections. We have a right now to make sure that an insurance company doesn't use what we're paying in premiums to get put in the pockets of executives in big salaries. That money has to now be spent by law on health care coverage. But this bill would say, no, those who are expatriates would qualify for different plans that don't have to meet those Affordable Care standards. Why should more than 13 million people who are in this country legally and on their way to becoming U.S. citizens, who today have the same protections you and I have, to not be discriminated against for pre-existing conditions, because of this bill that's supposed to be for expatriates, now be told, no, you might be offered a policy that doesn't have to meet the Affordable Care standards? Why should an American family that sees its one of its breadwinners, father or mother, be sent abroad to work for 90 days be told, no, we no longer have to offer you an affordable care a health care policy that prevents discrimination against your child because he or she has asthma? If this were a bill to focus on the issue of expatriates who go work abroad, where I think it's a legitimate concern of the insurance company to not impose upon the insurance company costs that are beyond what are paid here, I would agree. But this goes well beyond that. And I would urge my colleagues to think twice before voting for this bill this way.
Gentleman's time
With that, I
has
yield back the
expired.
balance of my time.
The gentleman from California is recognized.
I continue to reserve my time.
Gentleman from California reserves. The gentleman from Washington
Is the gentleman from California ready to close? Do you have any more speakers?
I am ready to close.
Okay.
The gentleman from
Madam
Washington.
Speaker, I will close on our side. I don't think we have any more speakers here. I've been an expat. I was in the State Department. State Department sent me overseas. I lived over there. I came home 1 month a year on leave. The rest of the time I was an expat. That's pretty clear, an expat. My daughter teaches at the King's Academy in Amman, Jordan. She's an expat. She lives over there. She comes home in the summertime for a month or so. She's an expat. Everybody understands that. What this bill says is if you live in Seattle and you make 15 trips a year out of the country, then you're an expat, or you can be considered an expat. Now, that's not exactly what we thought, what I think most people think of when they think of as an expat. Or somebody who works as a contractor. Suppose you work for the federal government for 3 months overseas. Are you an expat? According to this, you are. You are not. You can easily be put in that category and not offered the protections. That means you don't have any protections around the issues of pre-existing conditions. You can't put your kids necessarily on your pay for up to age 26. Your lifetime limits, all the things that are built into the Affordable Care Act, the insurance company now can say, we don't have to offer that to you because you're out of the country 15 times a year. Or you've worked overseas for 90 days. Now you are creating, and as Mr. Waxman said, you are creating a second class of citizens in this country. And Mr. Becerra raised the issue on the reverse side. People who come from other countries are expats, right? Because they came from somewhere else, so they're not entitled to they can be put into a plan that does not give them the protection of the ACA. That's not what I think my friend from Delaware or my friend from California really wanted to do. What is missing here is that we did a backroom deal. We had members of Congress sit in a back room somewhere with somebody from the White House and talk about something and decide something, and here it is, fait accompli. No chance to change it. No chance to make it better or make it closer to what people really thought. And most interestingly, for Republicans, is you're sending a bill to the House and expecting that the Senate is going to fix it. Now, our experience here on the floor and in the Congress in the last few months, expecting the Senate to do something is, it's probably, it's not like wishing for the tooth fairy, but it is certainly putting your trust in a rather weak situation. The House sent over, 500 bills in the last session? And got 12 or 15 back? And you're saying that this one's going to be fixed. I doubt it. And I urge people to vote no on it.
Does the gentleman yield? Gentleman yields back.
I yield back the balance of my time.
Gentleman yields back. Gentleman from California is recognized.
Thank you, Mr. Speaker. Mr. Speaker, sometimes in this body and with the Senate, we can sit down for the common good of the American people. Sometimes we can sit down with Democrats and Republicans working together, not only in the House, but also in the Senate. And also sometimes, Mr. Speaker, the arguments that are made on the floor are so ridiculous that they don't deserve a response. I'm going to submit a letter from American Benefits Council. I'd like to submit it for the record.
Without objection.
I'd also like to submit a letter from the U.S. Chamber of Commerce, also in support of this clarification.
Without objection, so ordered.
And I'd like to submit a rebuttal argument for the record so that people can really get to the bottom of what this bill is.
Ordered.
And with that, Mr. Speaker, I yield back the balance of my time.
Gentleman yields back his time. The question is, will the House suspend the rules and pass H.R. 4414? Those in favor say aye.
Aye.
Those opposed say no.
No.
In the opinion of the chair, 2/3 being in the affirmative, the rules are suspended. The bill is passed.
Mr. Speaker.
Mr. Speaker.
Senator from Washington.
I request 3 yeas and nays.
Yeas and nays are requested. All those in favor of taking this vote by the yeas and nays will rise and remain standing until counted. A sufficient number having arisen, the yeas and nays are ordered. Pursuant to Clause 8, Rule 20, further proceedings on this question will be postponed. Pursuant to Clause 8 of Rule 20, the unfinished business is the vote on a motion of the gentleman from California, Mr. Nunez, to suspend the rules and pass H.R. 4414, on which the yeas and nays are ordered. The clerk will report the title of the bill.
H.R. 4414, a bill to clarify the treatment under the Patient Protection and Affordable Care Act of health plans in which expatriates are the primary enrollees and for other purposes.
The question is, will the House suspend the rules and pass the bill? Members will record their votes by electronic device. This is a 5-minute vote. On this vote, the yeas are 257, the nays are 159. Two-thirds not being in the affirmative, the rules are not suspended, and the bill is not passed.